And the top two, number one is how can I get more efficient? That's the top one. Right?
Really?
Yeah, how can I get more efficient? How can I get faster? And yeah, the second question is
Hey, this is Ash, and welcome to All Things Dentistry. Today, I'm interviewing Dr. Daniel Choi. He's a very passionate educator, endodontist from Arizona. He created a Facebook group that is inspiring, and there's so many amazing things on it. So, without further ado, let's dive into this interview. Thank you so much for joining me tonight. I am super grateful for the time and the group that you've set up. And I wanted to share the amazing group that you have on Facebook called Endodontics for Dentists. And if you could, in a few words, summarize exactly what this amazing group is about.
yeah, so I started this group around a year and a half ago, I believe. And what we saw was that there's a really big gap in the knowledge of a lot of the dentists coming out. So we are geared towards kind of that first decade of school, new dentists, new word dentists. As I was on Facebook just talking to different people, DM me and have all these questions, and all the questions seem to be coming from this group of dentists 4 or 5 years out. Some of them were saying, "Hey, we don't have an endodontist within kind of 30 minutes to an hour of us, and we're getting all these patients, and some of them can't afford to go to the specialist, things like that, and they wanted to get better at endo." And so some of these new grads also so if they graduated in COVID, they actually didn't do a single endo on a live patient during dental school. And
Mhm.
so we just saw that there was this really big gap of knowledge. And there was such a hunger for these dentists to learn more bread and butter endo.
Yeah.
And so I decided to start the group. And we did. We started with 0 people and just started posting content, just trying to help as many people as we could. And it just kind of caught on, and people really, really saw the value of what we're doing, and they're really getting a lot out of it. So that's kind of how everything started.
It's amazing because you said you started about a year and a half ago, and now you're up to 3,000 members. And I've been following it every day. It's such a safe for people to post and ask questions. It's just incredible. Daniel, where'd you go to dental school, your residency, why you chose endo, and a few things about yourself.
Yeah, so I graduated dental school from Loma Linda University. Great school. Went to UCLA for my endo residency. Incredible program. And then after that, I actually started out my own practice. And so eventually ended up selling that. So that was a ton of fun. But eventually ended up selling that for a very millennial reason. And the millennial reason was because I wanted to pursue my passion.
All right.
I know a lot of people would be like, cool. But I know it's very millennial, but I'm a millennial. So, and so I had different opportunities, work for a lot of trying to find my groove and what exactly I wanted to do. What was the most meaningful thing that I could kind of get my hands on. And so I did a lot. I tried up a lot of different things. I worked for private practices. I did traveling endo.
Okay.
Worked for a DSO, kind of gaining experience in how do they do their systems and things like that.
Yeah.
Worked for a nonprofit multi-specialty clinic. And then now kind of in some education. And so I kind of have a lot of experience with a lot of different avenues of how endo can be deployed, I guess. And so far, it's it's been a really, really cool ride. I mean, endo has been just so amazing. I remember when we were applying for residency, people were asking, "Oh, is endo's going to be a is it a dying specialty? Why are you getting into endo? Like everything's going towards implants." And I just thought like, what would I want with my own tooth?
Yeah.
Um, and there's just so much demand for endo now. It's like ridiculous. I get people calling me like, "Hey, can you come and do endo for my office and stuff like that?" And there's just so much. So endo has been amazing. I've met such amazing people through endo. But that's kind of professionally. And then you were asking about personally, I have I've been married for 11 years and I have three young kids. I'm catching up to Ash,
Oh yeah.
right? I'm not quite there yet, but I'm catching up. And so 6, 4, and 2 got these little amazing kids running around and they keep us very, very busy.
What are, I mean, so what are some of the top few questions that you see repeated on on the questions that are comments or things that come up?
Yeah, so I appreciate everything that you said about us. We do really strive to be somewhere where it's a safe place where people
Yeah.
can ask questions. There are no dumb questions, and most of the people in our group are very, very willing to help each other out. And so we really, really appreciate everyone who's in our group. And that's kind of reflective of yourself as well. And so that's why we connected. I think that there's a lot of kind of synergistic relationship between how or a similarity in how we think and how we really want to help people learn. So to answer your question, yeah, so whenever people join the group, we actually have a question that says, before you join the group, what is the one question about endo that you really want to learn?
Oh,
And yeah, so it's pretty cool because we get it's kind of a survey of what are really the pressing questions that people have about endo. And the top two, number one is how can I get more efficient? That's the top one, right?
really?
Yeah, how can I get more efficient? How can I get faster? And so yeah, of all the 3,000 people that have joined, that's the top question that people always ask. How do I get more efficient?
Ah,
Uh, Yeah, the second question is how do I find MV2?
yeah, of course.
Yeah, yeah. So those are really the top two that I see over and over and over and over again. So when people talk about getting efficient, the thing that I've seen after I do one-on-one calls too, and we do a monthly coaching call, so people
Yes.
ask these questions too. The thing that I've realized is first I try to probe deeper, right? So where is this person at in their endo journey? So having a good understanding, are they doing simple cases? Are they doing pretty complex cases? What is their level first? After I've established kind of what is their level, then we can kind of get into the efficiency stuff where it's like, is their protocol, um, are they looking for the right things first? To me, speed is secondary. The
Oh
first
yeah.
thing is always quality, right?
Yeah.
Always quality. And so what I tell people is that quality begets speed,
Mm.
not speed begets quality. And so I really, really stress to everyone that I talk to, get your get good at cleaning the apical third, right? Because that's really the key thing that we want to do, getting patency and cleaning that apical third. And then once you have that down and you're doing the bulk of true good quality endodontics is all about, after you've established and you can repeatedly, predictably do quality endodontics, that's when we start talking about speed. And so there's a bunch of tips that will help you speed up doing same thing every single time,
Yeah.
right? Using the same burr, right? Using the same file for different circumstances. Being able to take an X-ray whenever you need to, right? And so there are a lot of little tricks that can improve efficiency here and there. But I think the biggest thing that I really recommend people to do is first do really good quality treatment, and then as you do better and better quality treatment, then and you pick up and you do more and more reps. Like we talked about this last week around a coaching call. That just doing reps, extracted teeth, reps on patients. And those are the things that we can't escape when we're trying to develop efficiency.
Well put. Just dealing with that apical third. Yeah, like visualizing it, treating it well, and then everything else kind of falls into place. Because yeah, I mean, getting that predictability. Because you're right. I mean, I've thought about it, but not really packaged it like that. So that's such a great way of putting it. I love it.
Yeah, yeah. A lot of this stuff is just knowing the basic fundamentals and doing them super super well. It's like when we're playing basketball, learning how to do a layup well, how to dribble,
Yeah.
before we do all these kind of fancy things, which are all great, right? And we should strive for those things, but um really getting the fundamentals down. Because I mean, think about it. If we're doing it fast, but we're not doing it well, right? I mean, how is that really doing the patient a service? Is it doing you a service? Is it doing your practice a service? We really want to drill down on the basic fundamentals of cleaning that apical third, and getting our irrigant down there, disinfecting, sealing it up. That's really the basic fundamental.
You know, those fundamentals can be so damn difficult to get to too. Just when you said it, like just getting down to the end of the canal. I just thinking about today. Just like, yeah.
Yeah. Yeah, definitely. I mean, it definitely challenges.
Yeah.
Top five mistakes that people kind of new to endo are making. Okay. All right. So the first mistake that I think people who are new to endo make is having unrealistic expectations.
Oh, yes.
Yeah. So I think a lot of people come out of dental school, and of course, it depends on where they've gone and how much experience they've had in dental school. But I would venture to guess that most I don't know I don't know if I want to say most, but a lot of dental students coming out of dental school really are not prepared to do endo at a high quality level.
Yeah.
Especially I would say maybe the kind of molar category, right? Maybe anteriors and premolars. Um, Most of these students, I think they might have done maybe 5 to 10 endos on extracted teeth.
Yeah.
And then five on maybe 5 on real patients. That's here in the US. Is it different in Canada?
I'd
I'm
say about the
curious.
same. We're almost depending on the school I've learned now, it canals. We're not even talking teeth. We're down to like five
Oh.
canals. So, and I think it's impacted by if there's an endo residency in-house, where the
Mhm.
school's located, within the city, and I mean all these little variables, but I think they all add up to funnel to the allowing the student to what the student will need, I think, to graduate.
Yeah, so I think a lot of the education is I think it's still good what they're getting. Could it be better? Probably. And it's just so hard because you have to get in when you're in dental school, you're just trying to get through it, right? You're trying
Yes.
to get enough patients for boards. I mean, you're not really, I mean, at the end of the day, you are trying to get better, but is getting better at endo more important than graduating from dental school? Probably not, right?
Just get through
So
it.
they're just get through it, just get through the boards, right? And so I think because of that, people have this idea that they expect to be almost proficient by the time they get out of school. And I think they're in for a little bit of a rude awakening
Yeah.
when they get into the real world and they're trying to do, they've done maybe 5 to 10 canals and now they're jumping into a patient. And a lot of these dentists, what I've realized is that they really want to do the right thing. Like a lot of
Yes.
these dentists, they have a really good, I think, a moral ethic in terms of wanting to do good by the patient.
Yeah.
And so I feel like they get into this dilemma where it's like, okay, my the owner doc wants me to do more endo, right? And I want to do more endo too, so I can pay off these student loans. And I want to do this for patients. I mean, this is an anterior. I think I should try it, maybe,
Yeah.
right? And so they're kind of in this dilemma where they don't really, maybe it's a case of they don't really know what they don't know.
Yes.
And
That's it
so,
too.
yeah. So I think that expectation that they're going to be proficient coming right out, or I don't know if they even proficient, but even of um clinically acceptable kind of category. I don't know if that should be assumed. Now, for some schools, I know they do a lot, right? Especially like you said, the schools that don't have residency programs, they tend to do a lot more.
Yeah.
In those cases, I think it's totally different, right? Um, so I'm definitely generalizing when I'm talking about all this stuff, and there are definitely going to be students that are great when they come out of dental school. Is it the majority? I would say probably not, but there are dental students that are dentists coming out that are doing great endo too. So I don't want to discount that fact.
Yeah,
Um,
absolutely. I
yeah.
think One of the things I've learned along the way in terms of training was that I would say 99% of people, healthcare providers, go to work not intending to hurt anyone.
Mhm.
They, it's all within, they want to help someone. But in terms of the skill of endo, which becomes very complicated, and like you said, you don't know what you don't know. Um, I've come to learn that most are going to perf a number of times, maybe within a
Yeah.
handful of times within the first series of teeth that they've tackled because they don't know what they don't know in terms of like
Mhm.
I don't know what a calcification. I kind of know what a calcification is in a molar or a premolar, but I don't really know or angulation things. So, and I'm sure you've seen that, and I think that's within totally the learning scope. But it's very interesting. Your number one thing that you've seen.
Yeah, so that realistic expectation, I think it's really, really important because it gives them kind of a gauge. It's kind of where your compass is, or it's where your threshold is, what cases you're going to take, what cases you're not going to take. And this is one principle that I learned is that endo is harder to do very well than it seems.
Oh,
Okay. But at the same time, right, based on what like we talked about this last week during our coaching call, this is what we talked about this a lot. But endo at the same time, it's easier to practice and get better than it seems too.
100%.
It's almost like a paradox, right? It's like it's actually really hard to get really good, but at the same time, it's so easy to practice, and
Yeah.
there's so many avenues for you to get better. So it's like both and.
Yeah. 100%. Extracted teeth, like we've talked.
Yeah.
You and I both
Yeah.
agree. It's like I think everyone would who's in the education realm would be like, you have this thing, you can practice on it, destroy it,
Yeah.
and keep going.
Yeah. So I'm curious. This is a question for you, Ash. So if you were to put a kind of percentage level on like how much of clinical endo could you learn just by doing extracted teeth? Like I'm curious what your thought is.
Yeah, I would probably say if you gave me, say, 300 or 400 extracted teeth um, without ever touching a patient, I'm just trying to visualize this, and then said, okay, go. I would say maybe 70, 75% because the other 30% are just movements of hands and in mouth and things getting in the way and you can't.
Mhm.
So yeah, I would say probably maybe 70%. I don't know. You could probably learn a lot. Well, I know you can without
Mhm.
doing it. What do you think?
Yeah, no, I agree. I agree on that number. I think, yeah, 70 to 75% sounds pretty darn close to where I would be at. The interesting thing is before I got into endo, I would actually go to endo externships to kind of visit their programs when I was applying.
I don't know
And
what are those?
so, well, basically you go to these endo programs
Yeah.
and you kind of shadow the residents, and sometimes you can you just look at what they do. You sit in on some of their literature reviews and things like that. And a lot of these a lot of these programs that are before residency, sometimes they're called preceptors and things like that, preceptorships. And sometimes they're foreign dentists and they come and they want to get into endo programs, stuff like that. And it's just extracted teeth all day, right? Extracted teeth all day. And so I remember one of the endo profs talking, and he was saying how that you can, I mean, doing extracted teeth is not everything, right? I think we all agree doing
Yeah.
extracted teeth is not everything, but you can
But
get pretty
yeah.
darn close to what you're going to experience in terms of like feeling patency, in terms of calcified canals,
Oh yeah.
calcified chambers.
Yeah.
You can get pretty darn close to what you're going to experience in a patient. And
Yeah.
so, yeah, so endo is really easier to practice than it seems. Number two, I would say is not understanding case selection. I think that's a big it's a big topic. Like knowing what cases to tackle, knowing which ones to refer out. There's going to be cases that you have to refer out, and knowing which ones are it's going to be super helpful for you. It's going to make your experience a lot better. It's going to make the patient's experience a lot better too. So I would say case selection. What do you think?
Uh, yeah, I mean, it's 100% that case selection is critical. But I mean, you're eager beaver and you want to, we've all been there.
Yeah.
And even with experience, a case comes up, you're like, okay, like, you know, here's the limit. And you just, maybe you're kind of like, oh, I'm going to push it a little bit and see, how well I can do it. All the things you talk about, technical proficiency, efficiency, and then outcome. I think that's where I'm at now. Just kind of how's the outcome and
Mhm.
where are we at? But definitely when you're brand new and you see that, you're like, I want to feel the experience of MB2 getting down it and then obturating it and be like, oh yeah, I did it. But that's pretty hard to do, like right out of the gates in terms of
Right out of the gate.
under five, your dentist case selection, and then trying to push the envelope a little bit. But you said it first, like you don't know what you don't know, so
Mhm.
it's challenging.
Yeah, it certainly is. And I think that's why when people have someone that they can ask, like
Yes.
yourself, right? Um, just someone who's ahead of them, where it's like they've done like people like you've done, I mean, probably thousands, tens of thousands of cases by now. And it's like you kind of have seen everything and they can ask you, hey, like, is this a big deal or is it not a big deal? Or is this a case I should tackle or is this a case I shouldn't tackle? That is like gold,
Yeah.
right? That's so it's because it's when they have continuous good experiences doing endo, they're a lot more likely to continue doing it and to do it well. But if they're constantly having bad experiences, they don't know when to stop. I mean, um that was my kind of fourth point is knowing your limits, like knowing exactly where to stop and how far you can go. Can you go farther? Can you not go farther? Those are things that are having someone who's been there ahead of you be able to kind of walk you through like, okay, this is a big deal or this is not a big deal. Hey, this is just personal preference or this is going to make a difference in your treatment. I mean, that's so helpful.
Because you've mentioned your one-on-one coaching calls. So I'd like to ask you, so how do those happen? Because a lot of this stuff I'm assuming you're talking about.
Yeah, so we have I mean we're still trying to nail down exactly the format that we're going to have.
Okay.
Right now, kind of our the thing that we always do is our monthly coaching call, right? And so that generally is every month. It's usually on a Wednesday, 8 p.m. Pacific Standard Time. And it's just a Q&A. Sometimes we have amazing people like you come on and we talk and such great feedback, by the way, from last week. We just had our first hands-on coaching session in August. So this was
Yeah.
August 16th to 17th. So I tagged you in that post, kind of
I saw it.
give
Looked amazing.
get yeah, give um I really wanted to I stand on the shoulders of giants, right? That's what I like to say. All these people that like Cliff Ruddle, um, Sonia Chopra, yourself, and these people that have just really dedicated themselves to education. And so that was the first in-person hands-on coaching experience that we had. And so that's when we just kind of go through and we do extract the teeth. That's all everything that we're talking about here, that's what we do, right? Um, and we'll also get on coaching calls where it's kind of in a one-on-one setting where we'll do a Zoom call or we'll do a phone call or something like that. And one of the comments that one of the guys he was telling me, I was like, hey, is there like what was the most helpful thing about this? This was sort of at the very beginning. And then this is kind of what we talked about is he said that just having somebody who's been there before me tell me what's a big deal and what's not a big deal is like it just eases my mind so much. And having someone to ask questions to is just so it just eases my mind when I don't know if I did this correctly on this patient and I just um or do I need to do it one visit or do I need to do it in two visits and having someone walk you through that is just really, really, really helpful. So
That's amazing, man. Good for you. And kudos to yourself for giving your time for that. Because I mean, and it's just, I'm, I'm certain it builds their confidence just to be able to talk to an expert like yourself, who's got no skin in the game whatsoever, just to be like, hey, listen, I can answer your questions and give you some guidance.
yeah, I mean, part of that really stems from, I'm sure this is part of your philosophy as well, is that like endo is not just a way to um, make ends meet, right? I really believe that we're all created for a purpose and we're all given gifts for a reason, right? I wasn't given this gift so that I could hold it to myself and just use it for myself and my own gain and maybe my patient's gain too, right? But I want to share this with as many people as I can. And so that they can impact people, right? So with my own two hands, right, I can only impact so many patients,
Yes.
right? But if we get into the education game and we help other people deliver high quality care, think about all the people that even more people that we can impact. And so that's kind of my thought process behind why we do what we do. And I think that there's just so many people longing for education like this. And it's really a great service to the patient. So
Man, that's so inspiring. That's amazing. I love it.
yeah, yeah, dude, it's really yeah, it's just really neat. So I'm gonna let me see if I hit on all these points here. Okay, so yeah, so we talked about not understanding case selection. We already number three was we talked about this too already, which is mastery begets speed. Mastery begets speed. Quality begets speed. And so the reason why I think that's so important is because when you master something, when you do high quality and well, you're always shooting for the same target. So you know what target you're looking for, right? Every time you're looking for that cleaning the apical third, sealing up the apical third. It's the same thing every single time. You know what you're aiming for. But if you don't understand what high quality is, um, then you're kind of shooting in the dark, right? You're you don't know when good is good enough, right? You don't know how long you should work for this patient. If you're purely being limited by the time that you have to see the patient, we might be doing a little disservice to the patient if we're just limiting all the the I mean there's obviously there are limits to this, right? We're not going to be looking for 4 hours for the MB2, right?
Oh my
I mean,
God. No,
so yeah,
no, no.
so so there are definitely limits. Um, but I think as you get better and better and you have that singular goal, clean the apical third, and seal the apical third, get your disinfection to the apical third. If that's the singular goal that you're trying to accomplish, from a technical perspective, I think that's actually going to make you faster knowing your goal.
Oh, absolutely. And can I ask you a very technical question? What size and what taper? And that kind of gives them the recipe. I know there is not a recipe, but it gives them that kind of
Mhm.
like, what's the, I don't know where to go because a lot of students that I work with that come through, it's one file, right? Finish with the
Mhm.
primary, the
Mhm.
2507, and you're good. Like, I can see all these retreats.
Yeah, yeah, yeah.
That doesn't
Yeah.
work that way. And so what number are you typically throwing out for some of these things?
Yeah, I think that's a great question. So the first thing that I would go to is principle. So the principle is that we want to clean the apical third, right? And so we
Uh,
work back from that. So if the principle is that we want to clean the apical third, what does that look like practically? It means that I'm getting clean dentinal shavings on the apical third of my file,
yeah.
right? So and so as soon as I see clean dentinal shavings on the apical third end of my file, I know that I'm in clean dentin, right? And usually I'll want to go maybe one or two steps above that just to make sure that it's nice and clean. Um, and so usually I'm finishing at maybe a 3504, 4004, kind of on these canals. Sometimes like a the important thing to know is that we take what the tooth gives us, right? The principle is take what the tooth gives us. And so in some cases, 3504 or 4004 is not or 40 apex is not going to be enough,
No.
right? Because they're so wide,
Yeah.
right? We got to go to oh 06 or we got to and so It really depends on what the canal gives, but 35, 35 to 40 is where generally I land after I get that clean apex. And on the palatals and distals of those molars, palatals and the distals of lower molars, a lot of times 4006,
Yeah.
um, clean it real nice. And so it kind of depends on, I mean, you know, there are different camps that talk a lot about these different, but for kind of traditional, predictable, that's what I like to kind of stay within. And if you're pretty new to doing endo, I would kind of stay within that kind of um, what is it? Kind of space. And based on everyone that I have so many endo friends, I've a lot of GP friends, and kind of that 35 to 40 is generally where I see people are at. Have you seen that? I think you're at a 35, right?
35.
Number four was knowing your limits. So I want to camp out here a little bit, knowing your limits, right? So this applies to so many different areas, right? How far can we trough for MB2 before we perforate,
Yeah.
right? How hard can we push a file before it breaks, right? How much can I work a hand file before it's going to separate, right? On a very calcified case, right? And so all these questions, not understanding what your limits are. And so there are people that I talk to, they're on both sides of the spectrum, right? For some people, they're way too aggressive and they need to calm down.
Oh, but okay.
Um, and they need to take an X-ray more. They need to take a
Oh,
bite
yeah.
wing more so they can see where they're going. But for other people, they're so gun shy, right? They're so gun shy that it's like you should probably trough for MB2 a little deeper. And so whichever side you're on, it's and a lot of times you don't even know which side you're on. Everyone thinks they're in the middle, right?
Yeah, that's a good point.
Yeah. But knowing which side that you fall on, like do you tend to be more aggressive or do you tend to be more gun shy? And to kind of alter based on that, and I think like we talked about before, extracted teeth are just a wonderful way of understanding where exactly you are at. And so if you're constantly perforating teeth, you're probably a little bit too aggressive or keep breaking files. But if you're constantly not finding MB2 too, that probably means that you might be a little too gun shy in kind of troughing and finding MB2. So there's this I forgot what the name of this curve is, but where it basically shows the confidence level of people when they do complex things. At the beginning, people are super confident. They're super confident, but as they do more and more and more, their confidence level actually goes down, and then it slowly goes up again. It's like some German name where this concept where when you're doing like more complex things, like you're learning or endo or whatnot, it's actually people get super confident. And then the most experienced people that you'll meet in endo or whatever category, they're usually like super humble people because they're like, I've done this so much and I know that it's not easy.
Um,
Um, and even these cases. Okay, so number five here is so this kind of gets more into kind of what we're doing here in the education space is I think the fifth thing is that it's a little corny and you can take this out if you want to, but it's that the fifth mistake is that new dentists think that they're alone, right? When they're learning endo, they think that they're alone. They think that they don't have anyone to talk to about these problems that they have. They don't have anyone that has been there before that won't kind of look down on them and really judge them and tell everybody how much of a bad dentist they are and whatnot. Um, and so I think that being in community, being around other good people, open-minded people, people who really want to help. I think that there are a lot of people that actually want to help and that are open with their knowledge, just like yourself. And
that's
I
you,
think
man.
that,
That's your whole Facebook group.
yeah, so
Amazing.
there's a lot of I think there are a lot of people don't the people who are the most negative are often the loudest. And so don't let that discourage you from finding help that you want and need. take CE courses if you need to. Reach out to people, say, hey, like I'm struggling with this, and hey, this happened here. Like, what is your kind of honest opinion on what has happened here? And I think that knowing that you're not in this silo where it's you and the patient and that's it, and the mistakes that you made or whatnot. I think that in itself is one of the mistakes that you don't have to be alone. You don't have to do this by yourself. Do this with the community. Do this with alongside other people who are learning just like you. Um, get into communities like Ash's group in your course. And there's just so many different avenues of information now.
I 100% agree. And that is 1,000,000% the reason why I wanted to talk to you and highlight your Facebook group because it's exactly what it is. There's people who like-minded who are not who feel alone because that's, a big detriment to dentistry is doing this all alone. And yet here's this out of the blue, this amazing group led by yourself with this amazing, inspiring attitude. So that, oh my God, it's just like literally segued into tip number five or point number five was highlighting the exceptional learning community that you've created. So kudos to you, man. It's amazing.
Yeah, thanks. I appreciate that. Yeah, coming from you, that definitely means a lot. You've been in the game in this educational space a lot longer than I have. And so I always tell people I stand on the shoulders of you guys, everyone who's come before us, and just that, adding to whatever everyone has already created, and trying to help as many people as we can.
Yeah. I'm so grateful you spent this time with us. Any other last points you want to talk about in terms of your Facebook group, how people can find you, and kind of where you headed in the future?
Yeah. So definitely find us at our Facebook group. Maybe can we link it? I don't know. I'm not sure if we can link
Absolutely.
it. Okay, perfect. But if not, it's Endodontics for Dentists. Just type that into Facebook. You do have to be a dentist to join. Um, and so there's going to be questions, and we don't let everyone in. So we've been getting a ton of like spam accounts and stuff like that. So answer the three questions. And that's the kind of best way to find us. If you have any questions, you can email me at danielchoidds@gmail.com, and be more than happy to chat endo with you guys. Any questions? Um, and that's where to find us. And your other question was kind of in the future.
Yeah.
So yeah, so in the future, there are a couple of things that we're working on right now. I think the first, we're going to continue our kind of monthly coaching calls for people who are interested. But we're also going to continue our hands-on coaching sessions.
Thank you so much for joining us. I'm super grateful, and hopefully we can do this in the future.
Yeah, I would definitely love that. And thanks so much for having me, Ash. This was really amazing. We'll definitely do it again.
All right, man. We'll talk to you later.
Talk soon.
Bye bye. Hey, Ash here, and I wanted to take a second of your time just to introduce our course, Root Canal Like an Endodontist. We've had it for a couple years, and we've had some amazing successes through it. Just confidence building on behalf of our students. And really, what happened was a few years ago, I wanted to create a course to help others because I know what it's like on your endo journey. A lot of times, you don't know what's going on. You don't know if you've ledged it. You don't know what to do if you blocked it. You don't even know if a curved canal, what to do. And what I wanted to do was take all my mistakes and my training from my residency and put it into a affordable online course for everyone around the world to join in. And it's been absolutely amazing. And I wanted to offer to you, check us out at allthingsendo.ca. Once you join the course, you get access into our private Facebook group where all of us answer questions. And I'm telling you, there are questions every day that you might be able to, I'm sure you'll be able to connect with, because sometimes it just takes a little bit of courage to ask a question and then your outcome may be incredible. Anyways, I look forward to seeing you there. allthingsendo.ca. We'll talk to you soon.